Hi, my name is Gwyneth and I will be talking about prostate cancer. The reason that I chose this disease to talk about is because my grandpa actually had prostate cancer back in 2015, and because he had this, it weakened his organs so much that he ended up dying of kidney failure. So prostate cancer is a form of cancer that occurs in the prostate in males, obviously. The prostate is a small gland that just nourishes and transports sperm throughout the male. This cancer occurs when there's a change in the DNA in a male's prostate somehow. So basically, what happens is the cancer cells will grow and start to multiply to surround the male's prostate and its tissue, and then it forms a tumor. So these cells can grow outside of the prostate or they can remain localized inside of the prostate, and it just makes it bigger. It's very common and it occurs in 1 in 8 males in the United States. It is actually the second most common type of cancer in males behind skin cancer. So there are many risk factors to prostate cancer. Cancer.net stated that about 60% of prostate cancers are diagnosed in men that are around 65 years old. It is recommended that all males get tested in their early 50s for prostate cancer because it is so common. Men with a brother or a father that have or had prostate cancer have double the chances to develop it. Actually, men with a brother that have it have even more of a likelihood than men with a father that had it, which I thought was kind of interesting. Men who consume a lot of dairy or calcium also have a way higher risk than men who do not. There are many symptoms for it, but the most common are frequent urination, blood in the urine, or pain during urination. If the cancer is spread outside of the prostate gland to its surrounding tissues, then it can cause pain in the back, the neck, or the shoulders. It can cause dramatic weight loss or even constant fatigue in the male that has it. The CDC says that the most common type of diagnosis is a biopsy, and this is basically just a small surgery where the doctors will go in and take out a small part of the prostate and examine it underneath a microscope. They will, after examining it, grade it on its Gleason score from 2 to 10, which is basically a score that just tells you how likely it is to spread throughout the male's body. The lesser of the score, the lesser the likelihood for it to spread. And then Urology Health states that there's another common way of diagnosing, and it's blood testing. This basically just measures the prostate-specific antigen levels in the male's blood. And this test does not actually tell you if you have prostate cancer. It just will tell you if you have any cancer at all in your body. And then they will go in and figure out which type of cancer it would be. There are 2 main types of treatment. The first is a prostatectomy, which is where the prostate and its surrounding tissue is removed from the male's body. This is actually what my grandpa had whenever he had prostate cancer. And then there is radiation therapy, which is using x-rays, obviously. This can be either internal or external. External is whenever the radiation is directed at the cancer cells from outside of the body. And internal would be when radioactive pellets are actually inserted into the male's body right next to the cancer cells, which will shrink and destroy them. There are new treatments being tested out for prostate cancer. The first one is cryotherapy, which is freezing cancer cells, which I think would be really cool if that worked. The next is hormone therapy, which would be blocking cells from getting the hormones that they need to grow and develop inside the body, so they would have to die out. Or chemotherapy, which is basically using drugs to shrink or destroy the cells. And that is all I have for prostate cancer. Thank you for watching.